It's now my privilege to introduce a gentleman who represents a company with decades of experience in helping caregivers optimize the health of their patients and communities. Cerner Corporation, recently acquired by Oracle, has merged the worlds of IT and healthcare, and in 2018 signed on with the Department of Veterans Affairs to modernize the electronic health record of VA, allowing easier access to higher quality health care for our veterans and simplifying the patient experience. Appointed as President of CEO of Cerner on October 1st, 2021, Dr. David Feinberg is a proven leader in the healthcare field. He remains driven by the passion and leverage technology and enable providers to deliver the best clinical care, and he stands poised to prioritize quality outcomes in healthcare today more than ever before. Please welcome our esteemed guest, Dr. David Feinberg.
Hey, thanks, Tim, for that warm introduction, and good morning to all of you. I have three things I want to talk about today. The first is I want to introduce myself and why this mission that we're on with the Department of Defense, with the Coast Guard, and the VA is so personal and important to me. I then want to explain actually what we're doing, and then I want to give you a glimpse of the future. So let me start with me. I'm a doc. My wife's a doctor. We have two kids, Rachel and Ryan. Rachel just turned 30, she's our oldest. And Andrea and I, my wife, both trained at VAs. They're now called the Greater Los Angeles VA, but I was at what was then the Brentwood VA. I'm trained in psychiatry. And Andrea was at the Wadsworth VA. And we would take call, sleeping over in the hospital the same night, because when you're newly married, if you're on call on different nights, you actually never see each other. So we would share a bed, a single bed, in the psychiatry emergency room call room while Andrea was pregnant with our daughter Rachel. So the three of us, or two and a half of us, really became a family, personally and professionally, by working at the VA. There's a particular patient that I will never forget. So I'm new in psychiatry, and this new patient that I get is a woman, a veteran, who's acutely suicidal and has a long history of alcoholism. And she's homeless. This is about 30 years ago to the day. I'm not sure as a doc how I'm going to help her. And I feel in a lot of ways she reminds me of my mom. She happens to be the mother of three boys, and I'm the middle of three boys. I worked my heart out doing the best I could for her. She got discharged, and I walked by her room after she had left the clinic, left the inpatient unit, and on her bed was her blue book from 12 Steps. And I was so upset that she had left it. I picked up the book, and actually she had left it intentionally as a gift for me. I still have that book today. And I want to thank all of you for allowing Andrea, myself, and all the other physicians in the United States who train at VAs for allowing us to understand how important caring is and having the privilege to care for our veterans. So now let me describe what we're doing at Oracle Cerner. We're installing the largest electronic health record that's ever been done in the world. What does that mean? When you go to the doctor and they're looking at that computer and they're trying to find your colonoscopy, or they're entering information, or they're asking you for the 20th time, do you have allergies, or are you still taking that medication, they're using software. That medical software is being replaced. It's already been completed through the whole Department of Defense, Coast Guard. It's about 50% with the DoD. And we're about at number 5 or 6 in the VA installation. It'll take us another couple years. And when we're done, whether you're being recruited, whether you're in active duty, whether you go for care in the community or get your care, some or all of your care at the VA, you'll never be asked again about information because it will flow seamlessly back and forth in one installation across all of those systems. There'll be no more carrying records. There'll be no more asking for CDs of a scan that you had. Those that care in the VA, the DoD, and the Coast Guard will have at their fingertips everything about your care so that they can provide higher quality care that's more equitable and safer. That's what we're doing right now. But let me tell you about the future. My previous job, I was running healthcare for Google. And one of our projects was in the United Kingdom to try to make care more predictive or proactive. So we worked with a couple hospitals over there. They happened to be using the software Cerner that I'm part of now. And what we were trying to do was decrease the time that the team in the hospital responsible for patients could diagnose acute kidney injury. A lot of folks who get admitted to the hospital may be admitted for something else, but if their kidneys fail, there's a very, very high mortality. Up to 25% of people can die from kidney failure. And if you don't die, oftentimes you end up on dialysis. So the hospitals we were working with were normally diagnosing acute kidney injury about 4 hours after it occurred. So we developed an app that we gave the nurses and the doctors that are part of that rapid response team in the hospital an ability to try to diagnose it sooner. And the only thing the app did was tell those doctors and nurses if a patient's creatinine, a blood level that looks at kidney function, increased. Just creatinine. By giving that signal on the phone that they were carrying, the time to diagnose acute kidney injury went from 4 hours to 14 minutes. 30% less patients had cardiac arrest, and there was a 17% decrease in the cost of care. So it was pretty effective to take this ability to get somebody a lab value quicker. And then this is what we did. We took that same algorithm, and in partnership with the VA, we looked at de-identified records of 60,000 patients in the VA, and each patient we fed to the computer over 700,000 different medical components, like their creatinine went up. But instead of just creatinine, 60,000 patients times 700,000 variables per patient, and said to the computer, can you diagnose acute kidney injury now faster than typically 4 hours, 14 minutes when we got that creatinine level to the nurses, and the computer came back with something that's completely mind-blowing. 48 hours, 2 days, before any clinical signs or symptoms, no changes in lab values, no changes in the person's physical exam, the computer, by looking at VA records, was able to predict acute kidney injury, who would end up on dialysis, with 90% accuracy, 48 hours before any human could have figured it out. So as we install this electronic health record across the VA, the DoD, and the Coast Guard, the goal is not only to make it easier for you to get care and it's more convenient and you don't have to carry records and you won't get tested again because the doctor can't find the test that you already had. It also sets the foundation for an ability to move into a new area of medicine of anticipatory care, predicting things before they happen. In this particular example with the VA, being able 2 days in advance to start thinking about a patient and what we can do to decrease them ending up on dialysis. So I'm here today, Oracle Cerner's here today, personally to thank you for allowing me to develop my skills as a clinician. When I got called last October to think about this Cerner opportunity, the VA installation was one of the major reasons that I said yes. Because much like Dan said before, I want to give back. I want to thank all of you for your service. I want to thank you for the ability to allow us to have the opportunity to make your lives easier when you're getting health care, either in active duty or when you're done. And finally, I look forward to joining all of you on figuring out ways to make care more proactive, more equitable, and safer, not only for people in the military and active duty and retired, but we will learn from this so it makes the entire world safer. Thank you very much.